What's the most important thing when a baby's born? They come out of the birth canal. What's the most important thing? There's a question on that. I didn't hear the answer though. That seems logical. Here's another question on cancer. Got a lot of cancer questions on here. And I think we heard a little bit about it. Cancers can sort of run off the rails and start making hormone-like substances. Right? We heard some about that today. The kidney can make hormone and hormone-like substances that cause a lot of mischief. The calcium level and hypertension and the like. So there's a question on that. What did we call that? You guys are too good. Here's a lipoprotein question. Now I beat that to death. What are the 4 lipoproteins in blood? And don't break my heart. Chylomicrons, what else? Well, we know LDL, right? LDL, HDL, okay, here we go. And what's the other one? VLDL, right? It's a question on lipoproteins. I don't want to spoil all your fun. Now, one of the problems we have with the brain is what? Well, I don't have enough neurons, but other than that, limited space. There's a question on the limited space of the cranial cavity. And I bet you can figure out what that question is when you see it. Do we ever get tumors in the lungs? And we see those a lot in patients that smoke, don't we? It's a question on that. Here's another brain question. So what are the 2 things we worry about in brain?
Tumors and trauma.
Well, we worry about the size of the space the brain has, right? We worry about what else? Stroke, somebody said that. What else do we worry about? Tumors, cancer. Again, if it's a tumor, there's not much space up there. If it's a space-occupying tumor, that can be a problem. Well, there's certainly a question on that. Boy, we've covered a lot of material. Now, when it comes to the heart, I tried to scare you as much as I could when we did that lecture. When you came out of that, what were you most afraid of?
Quit eating.
When it comes to the health of your heart?
Plaque buildup.
Diet.
Certainly talked a lot about plaque building up in your vessels, your coronary vessels. And what else did I tell you needed to avoid for your heart health?
Sedentary lifestyle.
Well, all of that, but those are, but the major risk factors have a lot to do with blood pressure. And you heard the kidney plays a huge role in controlling the amount of fluid in the vascular system. You've got to have just the right amount of fluid in the vascular system. Not too much, not too little. You have too much, you got hypertension. Too little, you're not perfusing your organs. And the tissue will die if it's not perfused. And so the kidneys play a huge role in that. But also hypertension is very common in our patients. And it sets a patient up for some diseases of certain organs. And then there's degenerative disease of the brain. We talked about all the diseases that you can have in the brain. This is a scary one too. There's a question on that. There's another renal function question. Boy, this thing is loaded with Dr. Thomas's material. Now, if you've got a little retention of fluid in your bladder and you're diabetic, what's going to be in that urine? Little glucose, really? So what would a critter like to have? Sounds like a critter would just love to get in there and set up housekeeping, right? When we do bacteriology studies in the laboratory, what do we use? We streak the bacteria, the specimen out on a culture media to allow the bacteria to grow. Well, that fluid, residual fluid in the bladder sounds a lot like a culture media. There's a question on that. So people that are diabetics and with any stasis or retention can certainly be at risk for, what was that disease, Dr. Thomas? You spend a lot of time talking about cystitis and things of that sort. So. And then we can have abscesses in the body. There's a question on abscesses. What kind of abscess scares you the most? There's a question on that. Here's a cancer question on renal. That should be fresh in your mind. Here's a question on the plumbing in the heart. I had a couple of slides on the plumbing in the heart. You need to understand the plumbing in the heart. And I'm talking about not the ventricles and the atria, I'm talking about the vascular plumbing. How does blood get to the wall of the heart, where all the work is done, the pumping? Right? So there's a question on that. And if you plaque up one of those arteries and end up with a blockage there, you might need to know which one is the worst to have blocked up. Here's one on another head question. I have a lot of head questions. If you fall and hit something, you might hit your head, right? That's not very good. There's a question on that. There's a question here on pulmonary function. We went over that pretty thoroughly already. There's a question here on cancer. What sort of things causes cancer? What sort of things cause cancer? Dr. Blakey talked about that. What do we worry about? Like we don't have enough to worry about. What sort of things do you want to avoid if you don't want to get cancer? Yeah, anything that's going to chronically irritate tissue, like soot in a cigarette, sucking that down in your lungs. And I don't think the vapor deal is much better, frankly. So what else can cause, what else can cause cancer besides chronic irritation and exposure to chemicals, like cigarette smoke? Radiation can cause cancer. How does it do that? Changes DNA, right? Can also create what we call free radicals. We talked about free radicals, right? All right, so then what's the third thing that can cause cancers?
Didn't you mention fat?
Well, yeah, a lot of fat can cause, chemicals tend to be organic and they'll accumulate in the fat. And that's certainly an issue. Can any critters form cancer? Bacteria? I'm not thinking bacteria. Okay. All right. Pretty big hint there. Now, when you worry about your vessels, you worry about plaquing them up. We talked about that. Well, there's other complications when you plaque up your vessels other than myocardial infarction. And there's a question on what sort of things can happen when you have a lot of plaque in your arteries. There's a question on that. And then there's a question we talked about when a person shows up with a really major headache, that could be an issue. If if you're an ED practitioner. It's a question on that. And then there's a question, CNS question, that you need to pay a lot of attention to the CNS lectures, especially diseases that people tend to get in their 30s, or chronic diseases. What kind of diseases are those? And then here's another, believe it or not, renal function question. Wow. What sort of things are on your analysis? We've been talking about that. On the dipstick UA, what's on there?
Protein.
Protein, nitrite,
White blood cell.
specific gravity,
pH.
pH. Should be acidic, right? Fixed acids get excreted by the kidney.